For the prior 6 years, I've participated in a free medical clinic for those less fortunate in Cusco, Peru. Through that process, I became persuaded of the effectiveness of a proper mechanical exam in a short-term mission setting. In August of 2017, I was able to return to Peru, this time for the inaugural pilot trip of Mechanical Care Everywhere, with 5 other well-trained therapists credentialed or diplomaed in mechanical diagnosis and therapy. Our objectives were to offer an introductory course of the McKinsey method to local healthcare professionals, explore the utility of a proper mechanical exam in a short-term clinic setting, and to attempt to collect some data on the effects of this intervention. With the use of translators, we reviewed a bit of their written information, took a thorough history similarly to how we normally assess our patients in our own clinics back home, and conducted a mechanical evaluation to classify and initiate treatment. In this small farming village of Corca, its people live simple lives, involved in manual work including bending, lifting, and climbing, but also in their fair share of sitting and walking long distances. They are a resilient people, relying on each other and struggling with plenty of aches and pains. We learned of their beliefs of what causes their pain and how they attempt to manage it. We came not to authoritatively tell them what was wrong with them and how we could provide relief for them, but rather to facilitate a mutual discovery of likely sources and reasons for their pain. With the use of effective, repeated, and sustained end-range movement testing, and when possible their own ingenuity, we searched to uncover effective, self-management posture and movement strategies. We learned that these are a grateful people, a humble and hard-working people, appreciative for the time we spent with them and the care they received. We learned that even with the limited time and encounters with them, many remarkable changes were experienced and relief was achieved. Oh, and one more thing we learned. Peruvians find great difficulty performing proper cervical retraction as well. Our original hopes were to explore the utility of the McKinsey assessment through this effort and to identify how to be effective and learn what doesn't work well. Just as Robin McKinsey was, we are convinced there are still so many who struggle with persisting and recurrent pain and need to be equipped with active self-care. My hope is that we will use this pilot effort, develop it further, and extend our reach to other underserved people groups all over the world. Stay tuned for future efforts.